As with so much else in our lives, the pandemic has changed general practice. The way that we interact with many of our patients is different, and general practice has stepped up to the challenge of remote consultations. These can often be appropriate and beneficial to the patient, but the option of face-to-face should always be available when it's needed. When the pandemic is over, it's likely that the balance between these remote and face-to-face consultations will remain changed from the way that it was pre-COVID. We want to ensure that GPs are supported to deliver this new normal and to maintain professionally and emotionally rewarding work patterns. As we respond to the challenge of COVID-19, some existing issues have become greater priorities, and areas have emerged where we must work with Welsh Government and the NHS to drive improvement. I've been encouraged to see RCGP Cymru Wales building new connections and growing its profile. The pandemic has highlighted the urgency of our long-standing call for the introduction of e-prescribing, that advanced care planning needs to be handled with sensitivity and communicated consistently as a means to empower the patient and to allow her to make the choices for their own needs. The value of protected time for professional and practice development is important. The need to access good quality IT, not just for GPs, but also for our patients. Indeed, on that final point, the digitalisation of general practice has accelerated this year, and we'd like to see more done to equip our colleagues with the best equipment to help us respond to our patients' needs. However, the technology must be our assistant and we must not become its slave. This profession will always rely first and foremost on empathy, understanding and compassion. The traditional image of the GP at the centre of our community is echoed in popular culture because that's who most of us are to our patients. But we'll be even more than that as our profession and our practice teams play a key role in helping communities rebound from the devastating effects of COVID-19 on our health, our society and our economy. The future vision for Wales is still emerging, but we can be sure that the GP will be at the heart of every community across this country.